Let's now move to the process of the interview. First, you will want to ask questions about your patient's personal history. In this section, you will need information about your patient's name if you don't already know it, the age with simple questions like how old are you or what's your date of birth if it is what you need. You will also ask about the patient's occupation, starting with one simple questions. What do you do for a living, for example? And once the patient tells you what their job is, then you go ahead and ask the probing question, like how long have you worked in the present job? What did you do before? How stressful is your job if it is stressful? How much physical work does it involve? How long, if they told you that they were retired, then you can ask, how long have you been retired? You will also need information about the gender. I am not sure you need to ask any question here, but hey, you never know. You will also ask about you'll need information about the height and the weight. Not necessarily questions here, but you might give some instruction asking the patient to stand up so that you can take their weight or their height. You will also ask about their family status. One simple question again, are you married? And if the question is yes, then you come with the follow-up questions, how long have you been married, etc. Then you will ask about the children, same thing. Do you have children? If the answer is yes, then you go ahead with the how many, how old are they, etc. Once you have your patient's personal history, you move to the chief complaint. Here it's all about determining the reason the patient is seeking care. You have here some questions that you could ask to get that information. You can ask, how can I help you today? Or what seems to be the problem? Or what brings you in to see me today? And then just listen to the patient. Once you have the information about the chief complaint, now you want to know about the history of the present illness, that is the chief complaint. First, you will want to know the timing or the onset of the chief complaint with questions such as, how did the problem start? Did it start slowly or suddenly? You also want to ask if it is constant or intermittent, meaning does it come and go or is it on and off? And you also can have some follow-up questions like how long does it last, how often does it occur? And then you will want to determine the duration of the chief complaint. You can ask questions like, when did it start? How long have you had it? Have you taken any medicine for it? And if the answer is yes, again, you come with the follow-up questions. What did you take? How much have you taken? And you can also ask, did the medicine help? After that, you will move to the location of the chief complaint with question like, where is the problem located? The problem can be swelling or pain or whatever as a problem the patient has. You ask where it is located, or you can just ask the question, where do you feel it? And then you will want to know about the intensity of the pain that is associated with the chief complaint. Again, you can start with just one open-ended question. Can you describe the pain for me? And then listen to the patient. And after the patient has given you the information and you still want to have more specific information, you can ask any of these questions. Depending on what the chief complaint is, and as a medical professional, you should have an idea of what type of pain is associated with the patient's complaint. So you can ask questions like, is it stabbing or burning? Is it constant or intermittent? Is it throbbing or pounding? Is it sharp or dull? These are questions you can ask. You can also ask the questions, does it radiate to the other part of the body? Does it keep you awake at night? Is it worse at certain time of the day? These are all questions that you will ask depending on the chief complaint of the patient. You don't have to ask all of them during the interview.